Well, and to start things off today, it is my immense pleasure to welcome to the stage Mr. Ben Folds. Thank you. So as many of you may know, Ben, in addition to being an amazing musician, has also been an advocate for both music education and music therapy. You want to share how you came to...
Yeah, I mean, pretty much like I find anything out, which is either going to be from fans of my music or my kids, and which are mutually exclusive, by the way. Yeah, we don't know what that means, but yeah, I mean, I was hearing a lot online about music therapy, and there was such an army of them. And they just kind of seemed like me, you know. And also I noticed, like, you know, over the years, being picked up, particularly at colleges, to go play university shows, that there was a trend of kids not going quite as much into like the $1 million making music business, but taking their talent and doing something pretty cool with it, and I just think that's great. So that's what I'm doing.
Excellent. All right. Well, we would love it if you would start us off.
What is this? It doesn't make much sense. They sing it like a pop song. You're capable of anything, and I'm sure they meant you could be president, or you could just forgive me. But I stopped caring what you think about me. I gave up. We're told we are capable of anything. You don't seem to think that you are capable of anything. Swung and missed, I poured my heart in this mythical holy good God. You want so bad to be, but I was weak and wrong. And when I owned it all, it only made you righteous. Now you get to blame your life on me, but I stopped caring what you think about me. I gave up. We're told we are capable of anything. You don't seem to think that you are capable of anything. Capable of anything. You don't seem to think that you could fly so low or sink so high, that you could ever love again or even try, that you could steal or cheat or kill or lie, but you might.
So Ben has agreed to weave improvised music that will transition us between our different segments today. So we're really looking forward to that as well. So the Sound Health Music in the Mind series explores the intersection of science and music. And over the next 90 minutes, we will explore breakthroughs with music therapy through a sampling of stories about recovery, resilience, and quality of life. You will hear from and about clients and families along with their music therapists who have kindly agreed to share their stories with you today. We also have music therapy research scientists who will be sharing the science behind those interventions. Music therapy at its core is a blending of both art and science. And our professional history is grounded in research. Through technological advances like brain imaging and the growth of interdisciplinary research collaborations, we are learning more about how and why music therapy interventions work. But what is music therapy? When you see a music therapist working with a client, it may look simple, but being able to respond musically in the moment to address a clinical outcome is a complex skill. In short, music therapists use evidence-based interventions to address the health or the educational needs of an individual working as a member of the treatment or the education team. The idea that music can be applied in music and health is not new. In the United States, the profession of music therapy found its roots in serving wounded veterans of both World Wars I and II. In fact, the Army conducted one of the first music studies on rehabilitation in 1945, over 70 years ago. The first music therapy degree program was established in the 1940s, and today we have 80 approved college and university programs, with about half offering graduate degrees, including doctoral programs. So digging deeper into that question, what is music therapy? Well, essentially, music therapy has four main elements. The first element is individualized music experiences. Those individualized experiences are also provided in a very systematic way. They're based on clinical assessment and research. Interventions are delivered by a credentialed music therapist who has the requisite knowledge and training to deliver both safe and effective interventions. And this is all done within the context of a therapeutic relationship. As music therapists, we embrace and promote both music listening and music making experiences for health and well-being. At the same time, it's important to know that while music can be relaxing and good for the soul, enjoying music and using it as a form of self-care is not the same as music therapy. Just like the work that I do with my personal trainer in the gym has tremendous health benefits for me, it's not the same as the services that I get from my physical therapist. The scope of practice for music therapists is broad, and it spans all ages and a large number of health conditions and disabilities, as well as for prevention and wellness. We wish that we could touch on them all, but today you have the opportunity to glimpse a few ways that music is being used to facilitate recovery, resilience, and quality of life. Well, we're going to start off today by taking a look at a clip from filmmaker Susan Koch's documentary film that's entitled Music Got Me Here.
The first approach I took to find his voice was breathing.
Breathe in.
What we call a straw breath. That was months and months of just breathing.
There you go, Forrest. Yeah, hold it tighter. Breathe in. Now breathe it out.
We would go to the piano and I would hit a note and I would hum a note and see if he could find anything in his ability to give me some sound back. Many times I would hum, and what Forrest would give me back in the beginning would be air. One morning, he was sick. And when he was throwing up, he sounded like this. That's your voice. And then we started to notice when you would give him a nice big hug, his exhale might have a to it. as soft as it is, his vocal cords are working. And then month after month, just humming and breathing.
From activating those vocal cords, which had been dormant for a year and a half, Boris, I think, came to believe again that he could make a sound. And Tom empowered him through that simple act of humming.
1 second led to 2 seconds, led to 3, and Forrest is extremely competitive. That's the athlete in Forrest.
Bigger straw. Can you make the straw bigger? Go.
I would say, oh, you only hummed 2 seconds. I would put my iPhone on the piano and I time us, and he'd always want to beat himself. He always wanted to beat himself.
Once he could begin to hum, then Tom worked with different pitches and different tones.
So if I hugged him and he did this, I'd try to find that note on the piano and hum it.
Let me hear you.
The music was reminding him that he spoke on pitch and that his voice sounded like something.
Yes.
It was melodic intonation and making sounds and hugging him and getting him to grunt that the first 2 words came out. Sung. They came out musically.
Breathe in the straw, buddy. Big straw. Fantastic.
And his first 2 words, good morning. Now, it was 5 o'clock at night. Didn't matter. It was still good morning.
Good morning. Big breath. Here we go. Yeah. Breathe in the straw. Good. Yeah. Breathe in the straw again.
After the moment that he sang good morning and I knew we were somewhere, yes, I went home that day. I went into every music therapy journal I could to find what do I do next.
Yeah. Breathe.
That was the moment that I knew that many other things would be possible for this young man.
Now, why don't we get you up and we'll try Unforgettable? Yeah, look at that, Forrest. Yeah, feels good to be up, huh? I'd like you to look right there at the words where Kyle is, so you don't have to look at me, okay? And
Unforgettable. That's what you are.
breathe.
Unforgettable.
And up in your nose. That's
Right,
my darling.
It's incredible.
That's someone so unforgettable. Breathe in. Thinks that I am unforgettable. Yes. What a day, huh? You were fantastic today.
It's been over a year and a half that we've been waiting to hear your voice again. We kept telling you your voice was there, it would come, but it just was waiting. And you found your voice with Tom's help. And yeah, it's absolutely all I wished for.
I'm a believer in the scientific method, and I'm not a fan of anecdotal stories. This was one where he had been subjected to a large amount of standard therapies, and music therapy is what changed the game. There is no doubt about that.
Sometimes in our lives, we all have pain, we all have sorrow.
But if we realize
good to sing by yourself like that?
Occasionally.
Occasionally it does?
Feels better to have you help.
Oh, Forrest. Thank you. I like singing with you too. Schweitzer, music therapist, director at A Place to Be, and we're so happy to be able to share that with you. Forrest, has become a hero of mine, and I know over this weekend, I can hear some sniffles out there. I know over this weekend we are beginning to learn the connection between music and the mind. And really, I think after last night's concert, it's really not only about music in the mind, but it is about music in the heart. And instead of talking about some of the techniques and methods that we used, you saw some of them here, and we hope that you go and see the whole movie. We will have postcards out there, and we can tell you more about it. Susan Koch, the director, is here with us today. Thank you, Susan, and some of the producers of the film are here as well. But what I wanted to speak about, I want to speak about my hero, somebody that was in a coma for quite a while, somebody who thought he has lost his ability to live in this world. And what music has created for Forrest and I, is a connection and the belief that there is something greater to happen in this world when you are at your bottom. I myself, how I got into music therapy is music saved my life. And when you see the film, you'll learn a little bit more about my history, but I'm sure a lot of you out there understand. Many people grow up in a childhood of abuse and turmoil, and when I was 8 years old, my life was saved by a Sunday school teacher who lived across the street from me in a small town in Altoona, Pennsylvania, and she taught me to play the piano. And she told me that I could sing. And I knew at that moment that music was going to be my company for the rest of my life. And I had no idea that many years later I would be here with Forrest. Come on up, Forrest. So Forrest and I actually met when he was 5. I was his music teacher. I can't always say that he enjoyed music class.
Most of the time.
And we stayed friends, and I stayed his mentor, and then his music therapist, because at age 18, this tragedy happened.
I unfortunately made a really bad accident. I made a terrible decision. Tyler, back it up. Good boy. I chose to go snowboarding without my helmet. I thought it was better than that. I thought it would be fine. I wouldn't fall. I made that terrible decision. I went down a black diamond, went right, fell, slid a long ways, hit my head, wasn't wearing a helmet, suffered from a catastrophic brain injury, traumatic brain injury. Terrible decision. Hey, but I've got to live with that. I'm here now. Thankfully, I can walk and move and speak again, most likely because of Tom. Well done.
I was... So we as music therapists become part of the team, and we become part of the outlet and the future of a human being's transformational journey into finding their life again. The very first time I came to the National Rehab Center here in DC, Forrest was nonverbal and non-responsive, and I played the guitar at the bedside, and there was no response at all. The second time I came by, there was a little response just by his pinky, which
which he can use all of his fingers now. His pinky was keeping rhythm. And for his mother and father, this is another reason to see the film, the belief that there is hope. And in a world full of need of hope, his mother and father never gave up. In fact, I think his mother went past what any doctor, any of their prognosis, she didn't believe. And the very first day when we saw this pinky, she took out her phone and she took a photo. She's like, this is it. Everything was a celebration. Every little thing was a triumph. The very first time that he blew air through a recorder. And I have only been a music therapist for 8 years. But I have been a soul that has loved music, and I have been a soul that has wanted to try to give music to others since I was born. But when you're sitting across from somebody that you've seen since 5 years old, somebody who had vitality, somebody who had personality, charisma, and had a potential, sit there with a recorder in their hand trying to blow air, when that first note came out, that was the moment I knew that I must do music therapy for the rest of my life. And I also found out that why I call him a hero. So we have this funny thing where one day I came into, after we were working together for a couple years, I had really bad allergies. And this is after maybe his 15th or 16th surgery where he had over 100 stitches in his head. And I came in and I sat down beside him and I said, "Oh, Forrest, I'm so sorry. I'm not myself today. I have a headache." And, and Forrest said,
I know you have a big headache, but hey, you can't beat me. Sorry.
Yeah. And the biggest, after a year and a half of working with him and trying to find sound, on the second year of his recovery, it was Thanksgiving night. He had a Dynavox where he could use one finger to try to communicate with you. And there was no pressure here. On my way out the door, he stopped me, and he took a couple minutes to write, "Mr. Schweitzer, please help me find my voice." And we are here this weekend because of research. And all of my colleagues and my teachers are here from Berkeley and SU. I'm not a fan of reading articles. I'm not. I would like to be an incubator for all the amazing minds that are sitting out there. But I went into the research to find out, what do I do next? And that's why research is so important. And I didn't realize it until I started to look into the journals and what was written out there. From the AMTA resources to the schools across America to Europe, of course, and some of the music therapy work they've been doing. And I knew where to go next with him. But I think most of all, music created a connection to your family and friends, and maybe you can talk about that. There were many events we had that his friends stuck by him and created music with you.
Very true. It actually created a community for me. Speaking of, some of my friends are here in the audience. Thank you very much, guys, for coming. It honestly means the world to me that you came here to see me and Tom speak. That's incredible. I wouldn't trade anything else or the world for that. Well done, guys. And it's beautiful that you came here to see me speak. I can move and talk. I can sing again. Thanks to Tom. Good job, buddy. Well done.
So and we'll leave you with this. Forrest has also become a hero in our hometown, and you don't know this right now, but he has been through 29 surgeries, and the skull that you see right now with his bandana on, but the head you see, that is created from his ribs. And the skin that he has growing up there, that is from his thighs. So every day, no matter if you're a music therapist or you're somebody out there trying to love somebody, you're in education, you're in some sort of place where you see somebody and you know they have potential to be alive again. This is why this story of Music Got Me Here is so important. And it's a drip, a little drop in the need we have in the world for hope. And we thank you all. We want to thank the NIH, Kennedy Center, of course, Renee Fleming, Ben Folds, one of my idols, for having us here. And if you would like to learn more, Susan Koch, the director, is right here. We have our producer sitting right here. And anything else you want to say for us to close?
I would actually like to say one more thing. You said music got you here. Music got me here as well. It pretty much saved my life. It gave me the ability to speak again. I wouldn't be able to make tones, raise pitch, go up or down with it, unless I have music and you, of course, Tom.
Thank you.
Well done, buddy.
And Forrest is also, he's still working on all of his skills. He plays guitar for fine motor skills. And you know, all the pieces that music had creating this journey for he and I know this is a once-in-a-lifetime event, and I don't mean the Kennedy Center event. This is beautiful. This is the once-in-a-lifetime. And I think if everybody can leave this weekend knowing that music has a power that's so far beyond our knowledge, from the first time we hear our mothers use their voice and we want to relate to them, to some, I just sang at a funeral just recently, the last moment you're singing to somebody, or the power of using music to help somebody feel alive again. So please get more information about the film, and thank you so much for having us here.
Thank you all, and thank you very much, Tom.
Take a bow for us.
Thanks, buddy. Take a bow with me.
One more?
Of course.
One more for Forrest.
Tolliver.
One more bow. Come on,
Everybody watch
Tolliver.
this. Tolliver.
Tolliver is
Take a
from
bow.
Canine Companions.
Good boy. Well done. Good puppy. There you go, buddy.
Tolliver is truly Forrest's best friend.
He's not lying.
Thank you.
Come on, puppy. Let's go, buddy.
Good afternoon. I am Dr. Wendy McGee, and I'm a professor at Temple University in Philadelphia. I'm a music therapist who's worked as a clinician and a researcher for 30 years with people with acquired brain injury, and I'm also a Cochrane reviewer. So I am going to talk to you today about the evidence underpinning some of the remarkable story that we heard from Forrest about his recovery, and talking through the science underpinning that. I'm going to be, we've already heard one of the important types of evidence, which is patient preference. Very important type of evidence to guide us in what is effective in healthcare. But I'm going to be speaking to you about a different type of evidence, and that's the evidence from science, specifically neuroscience, and also the Cochrane Review, the most recently published Cochrane Review into Music Interventions for Acquired Brain Injury. And Cochrane reviews are meta-analyses of all the quantitative research, the randomized and clinical controlled trials that have taken place on a particular intervention. So these meta-analyses are the most powerful pieces of research in healthcare because they pool the results from lots of randomized controlled trials, giving us a stronger basis of evidence. So first of all, really important message here. When we listen to music, when we hear music, it excites the circuits in our brains involved in reward, pleasure, and motivation. And when we're thinking about people who've had acquired brain injury and going through rehabilitation such as we saw Forrest, we can see that how important this might be, that music actually motivates us and actually keeps people going forward with this very boring, repetitive, hard work of rehabilitation. So, and I just realized I'd flicked through a slide I'm just going to come back to. There was a message before this. Okay. No, we're stuck on this slide. I seem to be having a problem with this clicker altogether. Oop, there we go. Okay. I actually want to come back, if anybody can just bring me back to the second slide. And one more back. Okay, thank you. So what I wanted to, there are 3 points I'm going to cover in this presentation about the evidence. We heard Dr. Charles Lim talk last night about music being a robust stimulus for the brain. And indeed, the neural basis of music enhances our functioning following acquired brain injury. So 3 points here to think about. Music has a hotline to emotion and motivation. Also, rhythm drives our movement. And lastly, music can change the brain structures following neurological damage. Okay, next slide, please. And we've already covered this one about music exciting the circuitry involved in reward and motivation. And the next slide, please. An important point here is that rhythm and music actually affects our movement. Literally, the auditory system in the brain is a fast and precise processor for timing information. So what this means is that what we hear influences how we move. So literally, in rehabilitation, rhythm works. It gets us moving. Next, there we go, okay. So, okay, I'm sorry about this. So, one of the important findings from the Cochrane Review, the very latest Cochrane Review, is that rhythm methods improve gait following acquired brain injury. Gait meaning our walking patterns. A method known as rhythmic auditory stimulation, in which we use a metronome beat, sometimes embedded in music or sometimes just on its own, improves walking speed, increases the number of steps per minute, improves stride length in both the affected leg and the unaffected leg, and just improves general gait overall. And we wanted to, next slide please. We were particularly interested in comparing the effects of metronome alone versus metronome embedded in music, because there are a number of health professionals who are engaging in this type of research, looking at just using a metronome, and we wanted to see what is most effective so that we can use the evidence to drive interventions forward. And indeed, what we found out was that when beat is embedded in the music, it is more effective. So this is an important piece of evidence to drive forward your practice. We were also very interested to determine from this meta-analysis whether the type of interventionist, the person delivering the intervention, had an influence, whether people who were trained as music therapists had a different effect than people who were non-music therapists. And indeed, what we found out was that music therapists, the studies involving music therapists, had better results than those involving people who were not trained in delivering music interventions. And this may well be related to that finding about embedding the beat in music is more effective. And just as a sideline, you're going to hear more about quality of life in the following presentations. But in several other studies looking at rhythmic auditory stimulation, the people who'd received music interventions reported perceiving having a better quality of life than those who did not receive the music interventions. Now, movement is much more than gait. Next slide, please. Music is much more than gait, and we know that when we're playing instruments, that also involves movement. And music therapists typically use instrument playing as a way to address motor rehabilitation, particularly using exercises where people might be reaching across midline, they might be shifting trunk control, they might be using wrist rotation, hand rotation, leg lifting, or indeed reaching up and out and over. Next slide, please. And reaching down. So all of these are important in terms of motor rehabilitation. And what we found in our meta-analysis, next slide please, what we found in our meta-analysis was that music interventions involving playing of instruments improve the timing of arm movements. So again, this comes from analysing the results of several studies together. Next slide please. Now, we heard Forrest talk about his own journey in terms of finding his voice and using music to to rehabilitate both his speech and his language. And of course, we know about this very famous case of Gabrielle Giffords. And I'm just going to speak very briefly about the evidence underpinning these sorts of results. I'm going to refer to a study from neuroscience that used intense music interventions with people who'd had profound stroke and been left with complex language disorders following the stroke. These were people who were unresponsive to speech and language interventions. And what you're looking at here is a slide with, on the left-hand side of the screen, is a picture of brains before stroke. And then we're going to have a look at the slide of pictures of, before stroke, before intervention, before intense music intervention. And the picture on this side of the screen is of people's brains after intense music intervention. And this bright green line you see lit up is a structure in the brain called the arcuate fasciculus, which is an important connector fiber between 3 different areas of the brain involved in both motor function as well as communication, language function as well. And what we can see in this slide is that the effects after intervention are that after this intense music intervention is that the arcuate fasciculus is both longer and thicker with more fibers within it after intense music intervention. So this study actually helps to provide some evidence as to why or how music is affecting our brains and actually able to change the structures in our brains following acquired brain injury. Next slide, please. Oh, and keep clicking through. That's it, one more. Thank you very much. We also heard from Forrest's story about his very early days and him coming out of a coma. And some of the studies that I've been involved with in recent years have been working with people who have been through Forrest's situation, just coming out of coma. And what we know from these studies is that using music with people coming out of coma increases arousal, and then also starts to recruit attention mechanisms in the brain. Really important, because unless we have attention, we can't engage people in rehabilitation. So music can actually help increase arousal, enhance attention. And an important study that looked at music in the acute phases after stroke found that music listening after stroke actually enhances cognition, particularly functions such as verbal memory and, again, focused attention, but also helps to improve mood states. And if we think about how people have to deal with this long period of rehabilitation, how many years now?
Been a bit.
Yeah, it's been a bit, okay? So we need to find ways to actually help people engage with rehabilitation over a very long period of time. We can see the role music might have. It seems that merely listening to music engages the brain in a way, it aids the person to engage with sensory processing, which seems to free up the brain to deal with higher cognitive processes. So there's many arguments for using music in brain injury rehabilitation. So the neural basis of music enhances function following acquired brain injury. Music has a hotline to emotion. Rhythm drives our movement, and music changes brain structures following neurological damage. All of these findings I've referred to. One more slide, please. Thank you. All of these findings I've referred to are in this Cochrane review, which is accessible online, and I'd be very happy to receive email questions from people later. Thank you very much.
So our next segment is going to be focused on resilience. And today I will be presenting along with Dr. DeForia Lane, and we'll be talking with you today a little bit about music therapy for cancer patients, but also for patients with other chronic conditions. And so DeForia is going to lead us off today. Thank you.
This profession of music therapy captured my mind and my heart over 40 years ago, and it holds me fast. I'd like to share with you where and with whom I have had the privilege of being a music therapist, and it happened unexpectedly at this wonderful place called the University Hospital's Cleveland Medical Center. We recently changed our name. It happened in a way that was unexpected. I entered that hospital as a patient, not as a professional, to work as a music therapist. I saw the need because I was with others who were being treated. I had long experienced the impact of music on my own life and in the lives of the 247 developmentally delayed children with whom I worked as a music therapist daily. So to go from a developmental center to a 1,000-bed hospital, teaching hospital, was quite the trek. And for a fledgling like me, even more so. But university hospitals opened the door, and I walked in. So what happened 33 years ago? These are the people that we have worked with. I have now a staff, after writing many grants, a staff of 5 music therapists, as well as we train 4 interns every year. What do? We assess our patients as well as formulate an objective and intervention. We create especially individualized for them, and of course we always document and put our notes in the patient's chart. That was our team. Whoops. Well, quickly, you saw our team, okay? They are, we call them our A1 team. So what do we do as a service? We provide it for our patients and our families, at bedside, for those who are outpatients as well. We also have found it nurturing for the families, and often, I will confess, they need the care more than the patient. The staff, we love acknowledging the fact that caregiving can be difficult. And so we celebrate our nurses, our physicians, our social workers, our environmental care staff with song. We also give them techniques to use when at 3 o'clock in the morning we are not there. So we provide education as well for them. And then in the community, we want our footprint to extend beyond our hospital, and therefore we have gone to Hope Lodge. We provide services at Ronald McDonald House, a community center in a very low-income neighborhood, and we have 425 children at the Rock and Roll Hall of Fame and Museum of Low Income Head Start that we teach using literacy skills as the objective for our music therapists. 17 of us go there every week. If you don't measure it, it doesn't happen. So we are into research. You will see the top reason that we are often referred to patients is to reduce pain. Kathy Jo Gutzel, one of our quintessential music therapists at university hospitals, literally did a randomized control study of 200 palliative care patients. And she was looking at how music could affect their pain. She took her lap harp. She did a short guided imagery portion and for 20 minutes played at their bedside. Other nurses and personnel took pre and post tests of the patients in terms of their pain and etc. What happened was those who had music had a significant decrease in their pain perception. If you're into p-values, 0.001. We know that music also affects our anxiety levels, our depression. But take a look at the last one, mood elevation. I've had more opportunities to work with people who are facing the unknown when they go into surgery. One of the surgeons referred me to one of his patients because he loved music so much, but also he was a doo-wop singer. And unfortunately, after his surgery, he would not be able to sing anymore. He was having a total laryngectomy. Now, I'll be honest, I thought this may be contraindicated in terms of music therapy. It may remind him of the sadness of what he can no longer do. But quite frankly, it was just the opposite. We developed a wonderful relationship. He said, if I can teach you anything about how to work with people like me, and would you still give me the music in you, maybe this will be worth it all. So the day he was ready to leave, to be discharged, we did something special for him. I'd like for you to see if you think music was contraindicated. Would you run that one? Ooh. It does have sound.
You make it awesome.
A man with resilience, for sure. In terms of pain management, and underneath it all is the neurologic music therapy. I am very excited about the concepts of what that can do. I'd like to introduce you to a man who I met, a very elderly, lovely, dignified deacon in his church. He has experienced a stroke. He has expressive aphasia. He knows what he wants to say, but he can't get the oral mechanism and the connection from here to work. What I began to do is take a song that is familiar to him. The literature says we respond best to the songs we like most, and we also respond to predictive rhythm. So I took a song I knew he knew, and I asked him to hold my hand so that I could kinesthetically give him some input, and I began to sing. My interns are at the bottom of the bed playing, trying to get gospel. Okay? Watch his mouth.
This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. Let it shine, let it shine. Yes, everywhere I go, I'm gonna let it shine. Let it shine, let it shine, let it shine.
I enjoy that every time I listen. One of the best things I enjoy doing is legacy making, taking the thoughts, the feelings, the ideas of people who know their lives are short and creating something for them that they could pass on, that they can provide for their loved ones long after they are gone. We co-treat with our other professionals as well, and we found that twice as nice when we are working with those who are doing speech therapy and occupational therapy. There's more motivation by the patients. And when we use the neurologic music therapy techniques, it even spurs them further. They do more repetitions. Also, in our operating room, Jacqueline Palmer and I did a study in the OR, randomized control trial, again, looking at if the person's music that they liked most was sung to them before they went into surgery, would their anxiety levels be less? And it was, by far, significantly less. Lastly, there are times when I am able to, we have some wonderful people in the OR too, who take wonderful folks on rounds with me, mixing their talent with the science and the patient's openness. I want you to listen. I compose discharge songs for our patients before they leave. And I take all the nurses in with me in their room, give them lyrics, and we stand there and sing to that patient before they leave. Wynton Marsalis and Walter Blanding just happened to be there that day. You can play a little bit.
Okay. All right. Like we said, last flow, stay hydrated, pray and take your meds, and don't.
Okay. Let me set this up. You don't have to stop. You know Wynton can play. So what I'd like for you to see is this gentleman is a patient that has sickle cell anemia, and right before Sam Rogers-Melnick, our music therapist who works with sickle cell, went in, he was in a fetal position. Sam took the needs, the treatment mechanisms, taught them to him, and the man gets up and raps them.
You won't end up in the bed. Hey yo, all I'm trying to say is that this and what Sam doing is making a way for us sickle cell patients to free our mind. And sometimes it's tough. Hey man, sometimes it's rough, and sometimes you don't know what you gonna do. But with you, Sam, standing here and with the keyboard, man, I'm good, starting to feel like I can't walk up out of here.
I'm going to fast forward this. These are groups we held on the units, and at the very end you will see a patient, a brother, and a sister. The brother is the patient. The sister has flown in to see him in a very critical moment. They are not musicians. That's how I feel at the end of the day, I can tell you that. And just so I will end because my time is up, and I'm going to thank you for yours. But let me end by just telling you, one of the things I like sharing is the fact that, and my husband told me not to wear that dress. Is the fact that a song can be the connecting point at any time, any place, for anyone. What I want my patients to leave, and what I think all of us as music therapists want, is to leave them with a voice that music can portray. My roommate sings this, over my head, I hear music in the air, over my head, I hear music in the air, over my head, I hear music in the air. There must be a God somewhere.
So in the United States, cancer is the leading cause of death by disease for adolescents and young adults, and there's about 72,000 new diagnoses each year. And cancer treatment's difficult, and we know that about 2/3 of those patients will experience long-term effects as a result of their treatment. But we also know that adolescents and young adults who use positive forms of coping and have strong social support systems have better health outcomes after treatment. So what we were interested in doing was developing an intervention that would be uniquely suited to adolescents and young adults, help empower them to develop some positive coping strategies, and then also strengthen those social support systems as they move through treatment. So through the SMART trial, we were able to examine the benefits of a therapeutic music video intervention. This was a multi-site randomized controlled trial that received funding through the National Institutes of Nursing and the National Cancer Institutes, as well as the Children's Oncology Group. In fact, ours was the first behavioral intervention to be run as a limited site study through the Children's Oncology Group. This trial was specifically designed for adolescents and young adults who are undergoing stem cell transplant for cancer. And this is a very high risk and high intensity treatment. The intervention that we developed and uses songwriting and video production as a way for those adolescents to begin to identify what is important to them, derive meaning from their cancer experience, and if desired, to share that experience with other people. The intervention was also designed to help that adolescent strengthen those support systems as they're moving through treatment. You can advance it. So adolescents and young adults are a very unique subset of the cancer patient population. They straddle both the child and the adult cancer worlds, and they are probably the most underserved age group in cancer treatment. They get hit with a cancer diagnosis during a developmental period that is marked by tremendous growth and change. They're working to become more independent and less reliant on their parents. They're also strengthening their peer relationships, and they're making plans for the future. So it's easy to understand how difficult cancer treatment can be for an adolescent because they find themselves in a situation where all of a sudden they are relying on their parents for even their most basic forms of care. They're separated from their friends who have become their primary source of support, and their life plans get put on hold while everybody else is moving forward. So we were interested in finding ways to help them to do better. The question is, how do you help adolescents and young adults remain resilient in the face of a life-threatening illness? Well, this has been the life work of my good friend and colleague, Dr. Joan Haase. She was motivated to study adolescents who were doing well. How do they remain resilient in the face of cancer treatment? Because if we could understand how kids do well, that's going to help us develop interventions to help those who are not doing quite as well. So Joan's work resulted in a resilience and illness model, and through her model, she's identified risk factors and protective factors that contribute to resilience. Our goal with this particular intervention was to help adolescents overcome those risk factors by strengthening the 5 protective factors that are identified in this model. So why a music video? Well, I developed this intervention, and you can go to the next slide, great, to help adolescents express their thoughts and emotions that are related to their cancer diagnosis and treatment that might otherwise go unspoken. And as you can see from the quote on the screen, communication for adolescents can be difficult, it can be stressful, and oftentimes it's avoided in an effort to protect their family members, their friends, and even themselves from difficult emotional conversations. So we know that adolescents and young adults often use music as a form of self-expression. So this intervention actually provides a meaningful way for them to communicate and connect with people that are important to them. We used a standardized intervention protocol, and at the very end in the last session, the adolescent has an opportunity to have a video premiere where they can share their final product with whoever they want. And what we found through our study was that the adolescents were very invested in getting their message right so that other people could understand their experience. But we also found that our parents and other people who had the opportunity to view these videos felt like they gained a tremendous amount of insight into that individual's experience, and that was very important. So how does that intervention work? How does video production, music songwriting, how does that actually work therapeutically? So in this particular intervention, the principles or the theory that guides the work of the music therapist comes from my contextual support model of music therapy. I want to take a few minutes to explore some of those principles because they help us to understand how music can be used to create a supportive environment that then engages that adolescent so that they can derive the benefit from the intervention and those clinical targets that we are working towards, which in this case were coping and social support. My work is heavily grounded in motivational coping theory. And through those theories, they argue that we as human beings, our behavior is driven by three fundamental drives. One, we're all driven to experience competence in our environment. The second one is that we are driven to exercise our autonomy or our independence. And the last one is that we're driven to have meaningful relationships with other people. The other piece of this is important is that some environments will support those drives and some environments will inhibit them. And when you encounter an environment that inhibits that, you tend to experience stress. Next slide. So I want to talk a little bit about those environments. So stressful environments, they tend to be chaotic, meaning you can't predict what's going to happen in them. They also tend to be coercive, meaning your opportunities for choice and control are constrained. And then the last piece is that those environments can feel neglectful because you don't have support people in that environment helping you to navigate a challenge. When you think about hospitalization and cancer treatment, a lot of these qualities hold true. In contrast are supportive environments. So those environments tend to be structured. You can anticipate what's going to happen in that environment. They offer autonomy support, meaning you have opportunities to exercise meaningful choice and control. And then the final piece is that you have people in that environment that help you navigate challenging experiences. So this particular intervention was designed with these three principles at the center of it. We intentionally designed the intervention protocol to have these elements. For example, for structure, we use familiar music. We use some songwriting scripts and storyboarding to help offer structure. For autonomy support, the music therapist is working with that adolescent so that they can make all of the decisions about their lyrics, the visual content, as well as the people who will be involved in the project. And then that last piece, relationship support. The therapist is helping that adolescent facilitate invitations to involve people in their projects as a way to connect. So the next piece I want to talk about is the tailored music experience. So this intervention, it's actually 6 sessions that occur during the acute phase of stem cell transplant. We designed a intervention protocol that all of our therapists followed, and because this is a controlled trial, we had rigorous fidelity measures to ensure that that intervention was being delivered consistently across all of our patients and across all of our many music therapists that delivered the intervention. Now, the tailoring, oftentimes when you think of protocol, you think you're kind of going down a checklist. But even within a protocol, we use theory to guide the tailoring, and the therapist is making clinical decisions in the moment to offer more or less structure so that that adolescent can remain engaged in the intervention regardless of the amount of symptom distress that they're experiencing or emotional distress. So this type of treatment, stem cell transplant, is it's very difficult. So they experience a lot of fatigue, nausea, vomiting. They have fluctuations in their mood, and that can happen from day to day and moment to moment. So it's critical that the therapist be able to tailor that experience for them so they can be successful and derive benefit from the intervention. Next slide. So what I want to do is I'm going to share with you a very brief clip of a video project from Heather. Heather was 12 at the time of her transplant. And what you'll be able to maybe see from Heather's video is how the adolescents are using their lyrics, their visual images to communicate their experience to other people. And a nice note is that Heather's mom and dad are also singing with her on this particular soundtrack. I'm going to let you advance to that.
Somebody once asked, how can you do this task? I said, you just have to do it. Somebody once asked, how can you do this task? I said, you just have to do it yourself. Had to be strong, had to be tough, and I'll know when I've had enough. We could all use some kind of cure.
Okay. So what we did, when you look across all of these adolescents' projects and you begin to look at their lyrics, which was part of our analysis, you see those risk factors, the protective factors, and the resilience messages come through in their projects. And that ties us back to the resilience and illness model I mentioned before. So in the red text, you see those risk factors. In the green, you see protective factors. And in this particular example, we have positive forms of coping showing up, as well as spirituality, which are two protective factors. In the blue is that resilience message. So it's that adolescent's ability to move past the cancer experience, even while they're in the midst of treatment. Okay, so to close, I want to talk about what do we find. And if you want to go to the next slide, that'd be great. And the next one's good too. So what we found, we had significant findings for the intervention, and we were very pleased to publish those findings in the journal Cancer. And if you want to go to the next slide, basically what we found in summary was that in the midst of a life-threatening illness, our adolescents and young adults who received this therapeutic music video intervention reported using significantly more positive, courageous forms of coping as they were moving through this cancer treatment. This is very important because not only does that help them move through that acute phase of treatment, but those types of coping skills are associated with better health outcomes in survivorship. They also reported significant benefit in the areas of family function and social integration. And this refers to their ability, so these kids who got the intervention had better open forms of communication and higher quality relationships with their families, with their friends, and also with their healthcare providers. Very few interventions have been developed for adolescents and young adults, and even fewer have been found to be beneficial after going through a rigorous trial. So this is a really good finding for us in terms of improving their care. And due to initiatives like Sound Health, we're going to have the opportunity to continue to do these types of studies, and that serves to help advance the science and practice of music therapy, but it also helps to improve access to care for the patients and families who need them. So thank you.
Good afternoon, everyone. I'm Jordan Cochran. We're leading into this next panel. And I'm going to share with you a little bit of our story of our son, Joshua. And so we had our family plan all laid out. We waited 10 years to have kids. And I was deployed to the Middle East at the time. And he decided to come early. So at 8 weeks premature, you can see the picture here with my wife's hand in in the NICU, and he spent about 3.5 weeks in the NICU, and then came home right before Christmas. And over the next couple years, as he developed, we realized there were some indications that he might be delayed. And so we had him assessed for developmental delays, and he was assessed on the autism spectrum. And obviously we were devastated and challenged from a family and friends perspective, because we had nobody that had this diagnosis before. So we sought out every therapy that we could think of, from occupational to speech to behavior to physical therapy, and all those over the next 3 or 4 years, hundreds of hours of therapies. And he progressed and was almost at age appropriate, and it's not unexpected for premature children to be behind. So he had basically caught up at about age 5 or 6, but he was challenged in his hands, and so so once we realized that, we figured out, we did some more research and realized that we needed to figure out some way to bridge the physical, the neurodiversity, and to his brain, to the physical on his hands. And he was at the point where he wouldn't feed himself, couldn't interact in school, and the school wanted to introduce electronic aids so that he could stay with his peers, and we rejected that. We thought he could work through it with the right expertise, and that's when CJ, which she'll talk in a minute, came into our lives with music therapy. And this was really a game changer, because it was able to get past the sensory issues that he was having. Now, often the 30-minute sessions that he started on a weekly basis weren't 30 minutes of music therapy, but it was 20 minutes of him trying to figure out how to ways to get around of putting his hands on the keyboard, and her trying. It was a cat and mouse game, you know. And he used to watch Tom and Jerry a lot, so I'm guessing he got that from that. And her trying to figure out how to bridge that gap. And so all of her expertise in the music therapy and credentials were vital for him to understand and get through that, not just in the piano, but other instruments as well that were introduced through that process. And so we fast forward. Just a note, so he's standing on a sit and spin there watching the little Einsteins at the time. It's hard to tell from the picture, but that's a skill. Oh. And so fast forward 5 years, thousands, literally, hours of therapies that we couldn't bridge the gap until we were introduced to music therapy, and that, as I said, really was a game changer for our son, to the fact that he's performed in 2 musical theater performances in Annapolis with the Children's Theater of Annapolis. For the second, we didn't know the first one, but the second one, he had an audition, and the night before we talked about it, and he said, I want to play a musical piece that he had worked on, and it had a singing component too. So he's playing both hands on the piano and singing, and did an audition on the fly, basically, and got the lead part in the Rocky of the Rainforest play, which ended up last month. And so he loves that environment, and so maybe one day he could be on this stage performing at the Kennedy Center. And I'll close with a quote that he used in one of his end-of-year passages in 5th grade that he's in now. He says, "It always seems impossible until it's done." And that's a quote by Nelson Mandela, and he thought that was indicative of a lot of the struggles that he's had to endure through his life. And so I'll turn it over to CJ now.
So I'll use Hi, everyone. I'm CJ Shiloh. I'm Joshua's music therapist. I've been working as a clinician in the Annapolis area for about 5 years. Now, I started out in music education, and for 15 years, I worked some in the schools, but my passion was really for classical piano lessons in the same way that I was classically trained. Over those 15 years, I started teaching more and more kids on the autism spectrum, and that's what really inspired me to go back to school to get my music therapy credentials. So when I first met Joshua, he was 6 years old. I was finishing my internship at Kennedy Krieger Institute over in Baltimore. And in our assessment session, I was talking to Jordan and his wife, Kathy, and they were telling me that they had been involved with a lot of groups like Kinder Music, programs that were music-based, and that Joshua loved music, but it was really difficult for him to be involved due to an avoidance of sensory experiences, anything really that he had to use his hands to participate. Now, Joshua was and still is a really fascinating, really awesome kid, and he's watching this right now live stream, so I want to say, hi, Joshua. So I noticed at the beginning how very musical he was, even as a 6-year-old. Now, for you classical musicians in the audience, you might know the term rubato, and just even the word might conjure up really warm feelings for you. An example of rubato would be that ever so slight delay at the end of a beautiful phrase. It's something about music that is just simply felt and can't be taught rotely. Very difficult to teach rotely, at least. And this music stand just went all the way down. That's all right, I don't need it. But I noticed that Joshua was able to play in this way, at least within those brief moments that we were able to improvise together. I think Jordan was correct. It was probably about 10 minutes of the session that we were actually making music, and the other 20 minutes was working through behaviors. This is why I'm so grateful that I went back to school for music therapy, because otherwise I would not have known what to do in those other 20 minutes. Now this next photo should be of Joshua. Oh, it was already here. So here's the slide of my private practice. And this is where some examples of some of the instruments that we would play. Here's the picture of Joshua holding my guitar for the very first time. This was a huge day, and that's why Mom took a picture. Up until this time, he did not want to touch the guitar, or especially touch the strings. So I would be strumming along, and in order to keep his favorite songs going, he would have to strum the guitar. Didn't want to do it. I think I was probably improvising lyrics like, well, we need to do it anyway. Right, Ben? He's back there. And so time went on, and as you can see, he was able to hold the guitar, and that was a huge accomplishment for him. I incorporated a combination of clinical theories into my approach, using ideas from systematic desensitization to affirmation therapy. And I would present opportunities for Joshua to work through his sensory processing issues without even needing to talk about it. This is so crucial for a lot of kids on the spectrum when speech and language is so difficult to begin with. We as music therapists have the fortune of employing the universal language of music to communicate non-verbally. So I would present opportunities for Joshua to interact with a variety of different instrument textures and soundscapes around the music therapy clinic. I always wanted it, though, to look and feel like play. So I would position instruments around the room, turn it into a game, and some of the instruments had more sensory texture than others. I think it was this picture right there that goes kind of quick. Like a kabasa next to a wooden xylophone, or like a tambourine next to a deep djembe drum. And so it went with Joshua to be okay with different types of touch textures in the music therapy clinic. Now that he's a little bit older, we're also working on coping skills for when things in life just get overwhelming. But back then, we utilized a lot of planned ignoring of inappropriate behaviors, meltdowns, what we call an elopement from the room. And I would introduce music into the environment that was contagiously fun, harnessing my own enjoyment of the music. And soon enough, Joshua would notice that whatever I was doing seemed a lot more fun than the escape tactics that he had been planning at the moment. Once I was able to engage Joshua in music making and his natural music expression came into focus, we would share some great moments together, not just in music making, but also learning how to communicate with one another and to socialize. 4.5 years of working together, or maybe 5, you said 5 years. So it's been a while, and I'm happy to report to you that Joshua now participates in his full 30-minute session with me and with other music therapists in my private practice. Sometimes we still encounter challenges with sensory overload and the behaviors that that can lead to, but overall, his progress has been phenomenal. He's also gaining skills as a pianist, and this is the room where we work together on piano. And he looks forward to performing one day in a coffee house that I am starting up through my nonprofit organization called The Musical Autist. And the coffee house will be a place not just to perform, but also to practice, those social skills and equal opportunity employment. Even when Joshua was 6 years old, I would say to him, "You are a true musician." And he would come back every week and parrot like an echolalia. He would echo back, "I am a true musician." I think the music educator in me rejoices when I see how much progress he has made in his piano playing skills. But as a music therapist, I rejoice in knowing how Joshua can use his hands more functionally within his world. Thank you.
Hello, my name is Blythe Lagasse. I'm Associate Professor and Coordinator of Music Therapy at Colorado State University. I've had the privilege of working with individuals on the autism spectrum for the past 16 years, and this is my main area of research, how we can use music and music therapy protocols to help individuals on the autism spectrum reach their full potential. You may have heard the saying before that if you've met one person with autism, you've met one person with autism. Individuals on the autism spectrum have a range of skills and abilities. And as we see that in functional skills, we also see that in how individuals interact with music. We have Jake, a young boy, who can tell me the exact note played on a piano, and Millie, a girl, who is considered nonverbal, yet will sing the words to her favorite songs. Many children on the autism spectrum are very engaged and excited to participate in music. And in music therapy, we use this engagement, this excitement, and some strengths that I'll tell you about to help individuals reach their goals. We heard about Joshua's sensory exploration in music therapy. We might all agree that playing this instrument, the kabasa, would be really fun. In fact, CJ called it contagiously fun to interact with music stimuli. And that can help individuals to use their hands or to engage in sensory stimuli. But there's more that's happening that we know from the research. When we use rhythm, it becomes very predictable. Your brain, with just a couple of stimuli, can determine when the next one will occur. Let's do a quick experiment. I'd like you to snap on the count of 3. 1, 2. That synchrony that we hear is because your brain predicted and then completed a plan. When I pair sensory stimuli with rhythm, it helps the individual to predict their system, to predict and organize with that sensory stimuli, which can be much better than it being unpredictable. For that reason, many children on the autism spectrum will engage with sensory stimuli paired with rhythmic stimuli. We also heard about how Joshua was playing the piano. We know that music activates rhythm activates motor areas of the brain. Dr. McGee talked about this in rehabilitation. The same principles are true in working with individuals on the autism spectrum. We can use rhythm to help formulate motor plans so that we can play the piano. We can use our hands functionally to, say, activate a communication device, or we can do more complex motor sequences, such as moving legs, arms in different ways to navigate our environment. How rhythm helps us with motor movement is also how rhythm can help us with speech and social interaction. If you think about social interaction, it's a complex sequence of motor movements. Just to turn to your neighbor and say hello, there's so many things that need to happen. In fact, we see that most of the research on individuals on the autism spectrum with music therapy is in the area of socialization and communication. A recent Cochrane review, a meta-analysis, pulled together all the different studies and found 4 primary areas where music therapy could help with individuals on the autism spectrum, including social interaction, verbal communication, initiating behavior, and social emotional reciprocity. In some instances, music therapy could also help with nonverbal communication. Secondary outcomes included social adaptation skills and parent-child relationships. In this, we see that music can help individuals on the autism spectrum reach social goals, which is a primary need area for many individuals. At Colorado State, we did a study where we took children who were on the autism spectrum and had them in two groups. One group was a social group with no music, and one group was a music social group. Both groups facilitated by experienced individuals, an educator in the social skill group without music, and a board-certified music therapist in the music therapy social group. What we found when we analyzed the data was that individuals in the non-musical social skills group spent a lot of time interacting with the tools in the room, such as game pieces that they were using to interact, that they were supposed to be using to interact with the other individuals. Individuals in the music therapy group used the tools provided by the music therapist and the structure provided by the music therapist to interact with each other. We had more social interaction in the music therapy group, including significant differences in eye gaze and joint attention skills when we're together attending to something. We use rhythm, predictability, and structure in order to help individuals anticipate and respond socially. Motivation, structure, and excitement is one aspect, but there's more. Many music neuroscientists have looked at how individuals on the autism spectrum process music. The results have been very interesting. One study by Lay in 2012 showed that individuals on the autism spectrum had more activation of speech areas in the brain when listening to sung stimuli compared to spoken stimuli. I'll say that again. The speech areas were more active with sung over spoken stimuli. This study showed that individuals on the autism spectrum seem to have preserved activation of the brain for musical stimuli. You'll see the top row where they're showing spoken over sung stimuli, and there's differences between typical, which is TYP, and children on the spectrum. However, the bottom row, where it's sung stimuli over spoken stimuli, we see much more similar activation between the two groups. This tells us that there is a factor of music that is an advantage for individuals on the autism spectrum, that it is a strength for many individuals. This strength extends into emotional recognition. Many children on the autism spectrum have difficulty, next slide please, with recognizing emotion in other individuals, however, can recognize emotion in music. Furthermore, we know that reward networks in the brain are active in individuals on the autism spectrum who are engaging with music. We can therefore use this strength to help individuals meet their individualized goals. It's important, however, to recognize that it's not just the presence of music. Several studies have been done to look at if we just add music to the environment, do we reach outcomes with individuals? And they have not been successful in showing the same outcomes that we see in music therapy studies. Other studies have looked at background music. If we just play music in the environment, will this help individuals? Again, not the same success that we see in music therapy. This is because it is the intentional and specific use of certain music stimuli to help facilitate outcomes. One study that was done by Callis in 2012 in the Journal of Music Therapy even showed that different types of music had different types of joint attention skills in children on the autism spectrum. Namely, when children who were less severe responded better to more complex music, and children who were more severe responded to more simple music. The music therapist takes information that we know about music and we apply it to help reach goals, and then we adapt. When children are having difficulty in that environment, we change the music stimuli, we change the interaction so that we can help them reach those outcomes. In this way, we can help children reach goals such as social engagement and social responsivity, communication, expressive language skills, different cognitive skills, including working memory and attention skills. In fact, when we look at the music therapy literature, we see many different goal areas that are supported by music therapy, including social engagement, joint attention, social greeting routines can be improved with music therapy, self-regulation, and attention. And this is just the beginning. There's many labs doing research on how we can use music and music therapy protocols to help improve outcomes in children with autism spectrum disorders. In my lab, we're doing several studies right now. One study is we're looking at how we can change the networks in the brain by using musical stimuli to help with determining which stimuli we should focus on and which we should ignore. So we're using EEG, or electroencephalography, in order to tell what is happening in the brain before and after music therapy intervention. We're doing another study where we're looking at music creativity in children on the autism spectrum. How are they interacting with music alone, and then how are they interacting with music when we pair them with a peer who is neurotypical? In this way, we can also determine whether or not their social interaction is changed or is linked to their music creativity with their peer. This is just an example of some of the studies that are occurring. The take-home point is that in music therapy, we can really use music in order to help individuals on the autism spectrum reach their true potential and show their true abilities. Last slide, please. Yay!
Well, I don't know. Someone give me a beat.
So today's presentation has focused on research and breakthroughs in 3 areas of music therapy clinical practice. But the scope of the profession is much broader. More than 7,000 board-certified music therapists work in a variety of settings, serving individuals of all ages with a variety of health and educational needs. In some cases, insurance companies reimburse for music therapy services, but funding sources are varied and often complex to navigate. So we continue to work towards increased coverage to ensure greater access to services. Ooh, fast fingers. As the profession approaches its 70th anniversary, music therapists welcome your help to extend our reach and create programs and services for the many children and adults who can benefit from what music therapy uniquely offers. We ask for your support to continue research and to build clinical programs so that we can improve access to safe, quality music therapy services. Our thanks to the Kennedy Center and to the NIH and NEA. Special thanks to the American Music Therapy Association for its assistance with today's session, and to the thousands of board-certified music therapists serving their communities. So I'm going to ask our presenters to come back on the stage. Please thank Forrest Allen and Jordan Cochran. And joining them on the stage are also my esteemed colleagues Tom Schweitzer, CJ Shiloh, and Doctors Wendy McGee, DeForia Lane, and Blythe Lagasse. And then out in the audience, we want to thank once again Deborah Rutter, Renee Flaming, Dr. Francis Collins, and Susan Koch. And now Ben is going to help us out, or lead us, in a very special closing for today.
This is an old song of mine that's just become a life support system for 3-part harmony. I don't even remember what the song's about anymore. People with the lowest voices would take this. This part goes, ah. Give that a shot. 2, 3, 4. Perfect. People with slightly higher voices take the minor third and branch off. Goes, ah. Both parts together now. Beautiful. And the highest voice is the fifth. Ah. All 3 parts together. Perfect. You took a trip and climbed a tree. In Robert Sledge's party. And there you stayed till morning came. And you were not the same after that. You gave your life to Jesus Christ. And after all your friends went home, you came down, you looked around, and you were not the same after that. You were not the same after that. You were not the same. You see them drop like flies from the bright sunny skies. They come knocking at your door with this look in their eyes. You have one good trick and you're hanging on, hanging. You took the word and made it hurt and eased the people's pain, and for that you were idolized, immortalized. You were not the same after that. You were not the same after that. And you were not the same. You see them drop like flies from the bright sunny skies. They come knocking at your door with this look in their eyes. You have one good trick and you're hanging on, hanging on. You see them drop like flies from the bright sunny skies. They come knocking at your door with this look in their eyes. You have one good trick and they're hanging on, hanging on. You're hanging on. You're hanging on.
There you go, baby.
You sound amazing.
Ladies and gentlemen, please join us now in the grand foyer for the future of music and the mind with Dr. Collins and Dr. Murthy moderating.